Welcome friends, this is Dr. Jaitly, your cardiologist on your favorite site, MuniMeterHealth, the video channel which is on several social platforms dedicated to advance patient education as well as medical education, both for patients at large and of course to our medical fraternity. Welcome again. Mainly our interest is to improve the clinical outcomes through this initiative, and this has been my deepest belief that if you combine the medical education, patient education, and you can definitely impact on the clinical outcomes. So without any further ado, I'd like to delve into the subject matter today, and today is blood tests. Do they tell us anything? Well, it's important to know, right? And in the present state of the art of diagnostic laboratories and technologies and the imaging that's available, have the blood tests lost their mark? Probably not. This will be my major take on this. But the fact is that it does really have a very cornerstone impact in our ability to make certain decisions, clinical decisions, right at the outset when the patient arrives at the hospital, the clinic, or the medical office. So number one, it'll identify cardiovascular risk factors right away. So one, you will know what your HDL is. Now you know what HDL is. HDL is the healthy part, okay, the healthy cholesterol. LDL, which is the lazy part. L for lazy, H for healthy. I think we've done a video on that, so make sure, I want you to go back and understand that HDL and LDL, which I've discussed on a different video. Then you know what your total cholesterol is. So it's very important to know that. It's very important to know likewise what are your triglycerides. And they will be only identified through the blood tests. So very, very important. Now, total cholesterol should be obviously less than 199. And triglycerides, I think I've said that earlier, less than 150 preferably. LDL should be less than 100. And HDL should be only more than 40. And then you know you're in a good shape. Now, if you do not know any of these, then sometimes they like to just report your LDL-HDL ratio, for instance. They can just give you the HDL ratio, and that also identifies your cardiovascular risks. So it's very important. And do not forget a very, very important thing called FBS, which is fasting blood sugar, my friends, because that's so important now today to identify whether patients are pre-diabetic, diabetic, especially gestational diabetes. Like during pregnancy, they like to do the fasting sugars quite often, pretty much on every trimester, if you will, to ascertain if the lady is about to become diabetic, etc. And sometimes, of course, higher risk patients who have a family history of diabetes, they need fasting sugars more often. And then A1C. A1C is very important to monitor these diabetic patients. Once you have diabetes ascertained or diagnosed, then you'll really need to know whether the A1C is coming down. And again, less than 7 is preferable. And if it is more than it's 7 to 9, then obviously, the diabetes is a little out of control, I would say. But if it's definitely more than 9, then that is really it needs a greater deal of reevaluation, perhaps a consultation with an endocrinologist, or go over the medications more thoroughly. So 9 is very, very dangerous. Remember that. How does it help guide therapy? Well, one of the ways it's going to help guide therapy is by the following, as you're going to bring down the LDL by statins. So are the statins working? Now you'd like to know, are there other medications that you're prescribing to improve the HDL, for instance, like the omega-3 fatty acids, or niacin, for instance. Niacin also raises your HDL a little bit, not a whole lot, but it does. But are the triglycerides coming down with niacins? Are you using anything like lopid or various clofibrates? So clofibrates are very important. So you can look at the therapy for triglycerides and all of this. Then you can look for diabetes, anti-diabetes medicines. Are those anti-diabetes medicines that you're using, are those good enough to really maintain your A1C to less than 7%? So diabetes control, for instance, will all be mapped based on the blood test, because if the A1C is still stubbornly high, then you need to reevaluate that glycemic state and the medications that you're giving to that diabetic patient. Identify other vital conditions, of course, very importantly, like cancer, for instance. Is there a cancer, are there CEA markers or other markers that could be affiliated with cancer, and that may impact on the cardiac part, because many of these cancer patients, like blood cancer, for instance, you have leukemias. Leukemias, they could be identified obviously through a blood test. Anemia, very, very important, how anemia impacts on various anemias. It could be thalassemias, it could be sickle cell anemias. All these anemias will impact on the cardiovascular disease. Remember, we are only covering cardiovascular disease through this through these videos, so remember that. So again, a whole ton of information can still be obtained in order to impact on your cardiovascular disease if you have one, like an anemia. So if the hemoglobin is declining for any reason, are you not able to make enough? So you could run into cardiac output failures, we call it, or high cardiac output failures, and these are again prevalent in mostly anemic patients where hemoglobin is less than 7. Normally the hemoglobin should be about 12 to 15. So less than 7 is markedly severely anemic in those patients. They may require blood transfusion. So that could be a need to transfuse these patients, especially if they are. Then the T4 and TSH could be identified, and these are thyroid functions, as you know, T4 and TSH, and both will help tell us whether the thyroid is high or thyroid is fast, in other words, or the thyroid is very slow. So you could have a thyroid fast, or a thyroid slow, depending upon what the T4 and TSH, and that could impact on your blood medications, on your medications, and the rest of your. Because in hypothyroid patients, they could have high cholesterol as well, and you could continue treating high cholesterol, but if you did not pay attention to the hypothyroidism or slow thyroid, all bets are off. You'll never be able to. You'll be chasing your own tail, quote unquote. So essentially, you want to have your thyroid also fixed at the same time. While you're addressing the cholesterol. Just a few little other things like state of the other organs. Of course, it's very important to know what the state of the kidneys are, because most of the medications that you give will be either excreted via the kidney or via the liver. So these are the two major metabolizers, or excretors, if you will, I call them, because they are really the metabolic factory or the excretory mechanisms built in the body, which will. So kidney functions are very, very important. You like to know what the BUN is. You like to know what your creatinine is in order to justify giving all these medications, especially because somebody is hypertensive and you want to use drugs called ACE inhibitors, or you want to use drugs called ARBs. Now ACE, of course, the classic example is Capitan or Vazotec or enalapril, and the ARBs are Diovan and Cozar, etc. So these are very, very important agents which again impact on the kidney. Likewise, the beta blockers, etc., could be also metabolized via the kidney or liver. So they could have multiple organ excretors or metabolizers here. So liver is very important, because it's specifically so if you want to use a statin, again, if the liver enzymes, they tend to go up, then obviously you're looking at SGOT and SGPT. We call them transaminases. And if these transaminases, they're up, then there is a sign that the statins could be impacting on the liver. So you want to either cut down on the statins or stop the statins. So state of the organs are very, very important, especially the kidneys and the kidneys and the liver. So in a nutshell, what you've learned is blood tests. Do they tell us anything? Of course, they tell us a great deal. In fact, they are the cornerstone, I would say, for all diagnostic and initial workup needs for all our patients, especially for cardiovascular risks who are being seen in the emergency rooms, at the hospitals, at the doctor's offices, and the clinic. So you start off with that and start screening these patients then and identify their cardiovascular risk factors. Sometimes you can help diagnose. This is very important. I forgot to mention acute myocardial infarction and acute coronary syndrome. They could be seen to be identified by cardiac enzymes, and cardiac enzymes are chiefly the troponins, which are of two types, troponin I and troponin T, and then the second is, of course, the CPK-MB, the MB factions, which will help identify the acute myocardial infarction or even the acute coronary insufficiency in that individual in the emergency room. When you suspect these chest pains, patients who are brought into the emergency rooms, even though the EKGs are diagnostic, but many times the EKG early on, the EKGs may not change much. So the blood tests will be very, very helpful in the first few hours to really determine if there was a heart attack occurring or if the patient is having unstable angina. Should he or she be admitted or should be watched for a few more hours or can be discharged. So all that decision making can be helped by just obtaining these simple blood tests. So very, very important. Once again, folks, thank you for associating with MuniMeterHealth. Again, as I said, our major initiative is to enhance the medical education and, of course, the patient health literacy, so that we get better clinical outcomes, so you become more compliant and go and see your doctors more confidently, and of course keep up their appointments for all your blood tests, specifically the A1C if you had to do, thyroid functions or liver functions or kidney functions that the doctors ask you to come back and have them checked, etc., or whatever other blood tests they want to order in order to screen you for cardiovascular disease, etc. Okay, so once again, we'll meet again on a different video, and stay well and stay on MuniMeterHealth. Thanks again.